So, how did learning about the science of pain actually help me overcome 20 years of chronic pain? Well, what we know about pain is that all pain is influenced by our brain. Well, you might be thinking, but I have real pain, physical pain. My doctors told me I have a condition. It's not psychological. Well, historically, the medical field has given us the impression that our pain is one or the other. Either it's a test showing that something's wrong, or it's all in our head. Oh, we hate that, don't we? Well, when it comes to pain, this isn't an accurate view. A biomedical lens is great if you have something like strep throat, maybe a broken bone, but what researchers know now about pain is that it's never just a physical issue. All pain is real, whether a scan shows something or not. Well, if you're the kind of person who says, well, I don't care how something works as long as it works, that's me too. I understand. Now, there's people like Jim who take apart toasters to see how they work, and that's really important to them. But with pain science, you don't have to learn every detail of the intricacies of the science. Just having an understanding of how pain works in the brain and the body can give you power over this mysterious, scary thing called pain. Now, that doesn't mean it's going to remove all your pain, but it can be the key that starts to unlock your progress. Think about it this way. Before people understood the science that germs existed, they only treated the symptoms of their colds rather than understanding how they got sick in the first place. But once we knew about germs, then washing hands, maybe covering our mouth when we cough, were important tools that we could use to take care of ourselves. So once we, you and me, know how something works, we have more control over managing it. It equips us to be more active participants in our pain management care. With this knowledge, we're no longer just a patient being treated. Because we understand how things work, we become an active member of our medical team. So another benefit of understanding how something works is that it starts to reduce fear. And dealing with fear when it comes to pain is a very important piece of our pain management. Does your pain scare you? Mine sure did. I lived in fear a lot. Fear of not finding answers for what was causing all my pain to continue. Fear of not being able to cope with the pain. Fear of what my future might hold. Oh, so many more things that I was afraid of. On and on. But when I started to learn how pain works, it took away some of my fears. Just like Jim with his toaster, when you have a better understanding of what's going on, you can have less fear and anxiety.
Yeah, so in her last video, you can hear Debbie and her pain story and understanding her brain and how that really worked to help jumpstart her healing.
That's right, Jim. Also, there's a quote by Dr. Adrian Lowe, who's a pain neuroscience educator. And he says, studies have shown that your nerves will immediately start calming down when the awareness regarding the root of your pain increases.
Yeah, so if an understanding of pain is helpful, well, let's learn a little bit more about pain. Like when we talk about pain, the words acute and the words chronic, they often get mentioned. Tell us what's the difference, Debbie?
Yes, that can be confusing. Acute pain usually has a known cause, and it's a part of the body's natural alarm system. If you sprain your ankle, you actually want pain to warn you to stop putting pressure on it for a time so it can heal. Acute pain usually resolves itself in 3 to 6 months when the full healing occurs. Did you know that pain is actually helpful to us? It warns us of danger, and it signals us to take care of an issue before damage is done or before things get worse. Example, if you touch a hot stove, you really want to have your pain warn you that you need to move that hand. There are people who can't feel pain. Boy, doesn't that sound great? Well, it's actually not. It's a major problem for them, and they have to monitor their bodies constantly to make sure that there's not something happening that they're totally unaware of. But what if pain doesn't go away? You have probably dealt with that. Chronic pain is considered pain that lasts longer than 3 to 6 months. It can either be pain that continues as a part of a chronic disease, or it can be pain that continues for unknown reasons. So we have learned a little bit about pain today, and we'll continue to learn more about pain on this podcast. And that knowledge will continue to give us insight into proven ways to manage your pain more successfully. I actually have a biomedical condition that was only treated with biomedical treatments for more than 20 years, and I only got short-term results. So this pain science information set me on a path to much less pain, and more importantly, much more life, even though I still have a medical condition. If this episode gave you a better understanding of how pain is connected to both our brains and our bodies, please subscribe to keep learning more. I welcome your likes and comments. And next week, we'll talk about ways you can tell your nervous system it's okay to stand down. And remember, your pain is real, and there is hope. And my goal is to help you have your pain in the rear view.